Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects about 6.1 million children ages 4 to 17 in the United States. It is one of the most common childhood disorders, and it can continue through adolescence and into adulthood. ADHD is characterized by three main symptoms: inattention, hyperactivity, and impulsivity. Children with ADHD may have difficulty paying attention, staying focused on tasks, and following instructions. They may also be hyperactive and restless, and they may have difficulty controlling their impulses. ADHD can be a challenging condition, but there are a number of treatments that can help to manage the symptoms. These treatments may include medication, therapy, and lifestyle changes. How to detect ADHD? There is no one-size-fits-all answer to the question of how to detect ADHD. The symptoms of ADHD can vary from person to person, and they can also change over time. However, there are some general signs and symptoms that may indicate that a child has ADHD. These include inattention. Children with ADHD may have difficulty paying attention, staying focused on tasks, and following instructions. They may also daydream frequently, make careless mistakes, and have difficulty organizing and completing tasks. Hyperactivity. Children with ADHD may be restless and fidgety, and they may have difficulty sitting still. They may also talk excessively, run around aimlessly, and have difficulty taking turns or waiting. Impulsivity. Children with ADHD may act without thinking, and they may have difficulty controlling their impulses. They may also interrupt others, blurt out answers, and have difficulty waiting their turn. If you are concerned that your child may have ADHD, it is important to talk to their pediatrician. The pediatrician can evaluate your child's symptoms and make a diagnosis. Diagnosis of ADHD. The diagnosis of ADHD is based on a number of factors, including the child's symptoms, behavior, and medical history. The pediatrician will also likely interview the child's parents and teachers. There is no one definitive test for ADHD. However, there are a number of questionnaires and rating scales that can be used to assess ADHD symptoms. Treatment for ADHD. The treatment for ADHD depends on the individual child's needs. Some of the most common treatments for ADHD include medication. There are a number of medications that can be used to treat ADHD. These medications can help to improve attention, focus, and impulse control. Therapy. Therapy can help children with ADHD to learn coping skills and strategies for managing their symptoms. Therapy can also help parents and teachers to learn how to best support children with ADHD. Lifestyle changes. There are a number of lifestyle changes that can help children with ADHD. These changes include getting enough sleep, eating a healthy diet, and exercising regularly. If you are concerned that your child may have ADHD, it is important to talk to their pediatrician. The pediatrician can evaluate your child's symptoms and make a diagnosis. With the right treatment and support, children with ADHD can thrive. Here are some additional tips for detecting ADHD. Pay attention to your child's behavior in different settings. Do they have difficulty paying attention and staying focused in school, at home, and with friends? Ask your child's teachers about their behavior in class. Do they have difficulty following instructions, completing work, and staying on task? Talk to your child about their feelings and experiences. Do they feel like they have trouble paying attention, staying focused, and controlling their impulses? If you are concerned that your child may have ADHD, it is important to seek professional help. A psychologist or psychiatrist can evaluate your child and make a diagnosis.